So let's open up the meeting. It's now 7:02. We'll call the meeting to order. Is there anybody here for public participation?
I see no one on the call, Elaine.
I don't see anybody here. I don't see anyone either. Okay, so we opened up the public participation. There was no one here, so we will now close. Anything to do with public participation, we have no one. We could open up. You want to look over the minutes? Anybody have any comments on the minutes of July 18th?
I thought I reviewed these, but either this isn't the wrong version.
This is the wrong one.
This is the wrong version.
Maybe you updated it one more time.
I did update it.
Okay.
Because I know I did things. I'm trying to make it go down. Hold on. Okay, what happened to everybody?
I don't know. Where are you? I see you, Ruth.
I stopped sharing the screen, so we should just have, you should just have people on there now.
Except for me, I had to dial in, Ruth.
Yeah, I for some reason I don't see anybody now, but okay. Can we table these minutes? Because I know that I had done things like, hold on, let me, I had done things like made public participation a category.
But that wouldn't be minutes. That would be the agenda.
No, I'm looking at, but the minutes were done that way with the categories.
Oh, okay.
And I don't have the minutes in front of me now, but also things like Cindy tends to put these in the present tense and I correct it and put it in the past tense.
Okay.
So can we table these and I'll
make it a motion to table and review
Table
next
them?
month.
Yeah, and I'll find my, how come I can't see anybody anymore?
Can you see me?
Yeah, I see you.
Okay. I see Cindy's phone.
And I see, yeah.
Laurel, I lost you. You were
Right
there.
here. You can put it on gallery view. Can you see me?
Yeah.
Okay.
Oh, yeah, okay,
Gallery
here I
didn't
am.
work. Yep.
I minimized everybody. That was a problem. Sorry.
Thank you for making me look smaller and thinner and healthy. Thank you.
No problem.
Appreciate
So
it.
let me just find the edited version so I can give it to you so we don't have to go through it and nitpick little changes. Okay.
So was it when I sent the email out on, I think it was Monday, and saying, make sure you go to look at, I attached everything, and those were the latest. So,
That's what I thought.
but I'm not sure if
I think what happened is I emailed you back my corrected version, but if you didn't save it and override the old version, you still have the old version. So it's no big deal. I'll fix it before the next meeting.
Oh, I see it. Yeah, it did say public participation was none.
So
That's all.
let me just edit it and we can do it at the next meeting. It's not the end
Okay.
of it.
You, Laurel, you made a motion to table them.
Yeah.
I'll second that motion.
Second. Okay. All in favor?
Aye. Gorville, aye.
Linehan, aye.
Okay. All right. We will table the minutes of the July 18th meeting. All in favor?
the 15th, July
3 ayes.
15th.
Yep.
That was an aye on all parts.
Yep. 3 ayes. No nays. Okay. The review of the training. Did you want to speak about that first? Ruth, did you have anything to say or?
No, Laurel wanted it.
So
on
I
the
was wondering if you, I just thought we should, you know, if you don't mind, Madam Chair, I thought, that was everybody able to pop on that training?
Yeah, I did it.
So you know, I was sort of relieved to see some validation about some things that we have done, but also I thought it was really nice just to sort of be reminded on the techniques of how to coach people in public meetings, especially, you know, they didn't really handle online, but I think, you know, being articulate about this is, you know, as much as you want a question and answer thing, I think that's where certainly the last time we had an online public hearing, it's hard for people to hear that. They think that, that, you know, it should be a discourse. So however we can make that clear in a respectful way, I think will bring us far. But I definitely appreciated the very real, and it was kind of fun because we know both of those people, and, you know, we've seen them working. So I thought it was kind of cool that they picked up, because it was just it wasn't dry. You know, it was real. So I just thought it was worth mentioning.
Yeah, thank you. I did enjoy it myself. I liked the fact that it was just always the tobacco meetings seem to be the ones that draw
Well, that's
the most.
because DJ did it.
Yeah,
He does.
yeah, he did
That's
it.
what he
But
does.
those always have seemed to me to draw a lot of public participation. And I really like the fact that they reminded us about getting participation, you know, if someone wants to write in or email,
Yes. Yeah.
and being very direct and how much time they had. Because I've run into it myself when it's like the last minute and somebody sends that email and you're like, well, we're already closed, you know. I liked that part, but I did enjoy it. I was glad you recommended it, Ruth. I thank you. I really did. Candace,
I think it did reinforce the stuff that, you know, I had already told you about how to run a public hearing, but I think it had some good handouts and having it
No, I didn't
written
print the handout
down
out.
in a way, you know, that just kind of reminds, do this, then do this, then do this. You know, instead of me just saying, so don't forget this and don't forget
Right.
that, and blah, blah, blah. Yeah, I think it wrapped it up in a way that it's easy to digest, and I think it had a nice script for the chair to read so that, you know, the chair doesn't have to come up with their own introduction.
yeah.
So I think it was a really good reminder, and I think it provided some tools that we can use for SOPs that will just make it easier, especially with contentious. I mean, I've been in the not so good hearings where it's been completely out of control, and it's not fun. And if you don't set those ground rules and you let it get out of control at the beginning, it's gone. You'll never get it back.
I would say too that as long as we do Zoom meetings, that, you know, somebody be online who is nimble with pulling up pertinent documents. I'm okay at it, but it was really helpful when we had Jen sometime back in the spring saying, here it is, here's this, so we can look at it in real time. I think, you know, our meetings are recorded, and how we go about things and how we appear is important. And, you know, and we're all friends. There's not very many of us, but at the same time, I think we do a great job at the training. I thought was just really helpful in highlighting little bits where we could improve.
Well, if it makes you feel any better, the Melrose Board of Health has given up on technology, and we're meeting in person next.
Well, so here's a segue for you, Elaine.
We were just talking about that, Laurel and I, after doing so many of these, like 5 and 6 of these a week, I don't know about anybody else, I just feel like I've lost that real personal touch of like looking at people and listening to them. I know you can't see their mouth, but you can see their eyes, and you still have a little bit of a contact, a human contact in a meeting. And I wish there was a way. I mean, you have to think about a room size, and would the audio be good? Is they interested in this training, and, you know, where is, quote, a safe place to do social distancing, you know, and like Laurel said, outside. I think we need to have a little bit more personal I love this, but I still think we need that personal.
Well,
I
we can meet inside the downstairs conference room is, I can't remember what the max number of people are. I'll have to relook at it. I figured it out once before. We, as long as 5 of us can be there, and then, so what I think it's the school committee in Melrose is doing. So we can do that. We can meet in person and have the public attend through Zoom.
Mm-hmm.
Yeah.
As long as the room downstairs is big enough to accommodate 5 people.
Mm-hmm.
I can't remember what it was, so.
I think it
I'll have
said
to
40 or
remeasure it.
50.
Yeah, but it's also based on square footage, so as long as it's 1,000 square feet, which that's only 10 by 10. That room's bigger than 10 by 10,
100
right?
square feet.
Yeah, it is. Yeah.
All right, so I thought you're allowed 8 people per 1,000 square feet, so we would be fine.
100 square feet. 1,000 square feet? 10 by 10 is 100.
But the regs say, I mean, the order is 8 per 1,000 square feet
Okay.
indoors.
8 per
per
1,000 square
yeah.
feet, you're right.
Well, that's something that maybe, Ruth, if you make double sure that it is, it's something we can
Yeah,
contact.
let me remeasure the room.
Okay, that would
I
be.
know I did it before, I just don't remember what the results were, so I'll redo it. And if we can meet there, then we can meet there.
Mhm, that'd be great. Candace, did you have anything on the training?
Yeah, I thought it was great, and I definitely appreciate you sending it out, Ruth. I've never been to a public hearing, and so it was great to sort of listen to some folks lay out how to do it. And I think you guys made great points too about setting good ground rules, good clear ground rules before anybody gets up. I was thinking about town meeting, and I know that some folks got up there, and I mean, things weren't so bad, but there was definitely, you know, I'm sure there are regulars at these events that always have a lot to say and possibly are a little bit difficult to kind of rein in. So yeah, I think having clear guidelines. I also wouldn't have thought about making rules about folks wanting to readdress the group again to sort of like add more information or another opinion. And being clear about whether or not that's going to happen, and being clear or not about whether we were going to vote. Are we going to vote right there in front of people? It seemed like in the example, the folks at the hearing were expecting a vote and were pretty unhappy when that didn't happen. But if that plan is laid out before
Well, sometimes you don't know that until the hearing is over. So that's kind of hard to say at the outset, although you can pretty well tell whether it's going to be a nasty crowd or not. And if it's going to be a nasty crowd, then it's always better to vote at the next meeting. So you could do that at the beginning. And sometimes I mix up Melrose and Wakefield, but usually we have said in the rules, you speak once. 5 minutes, speak once, think about what you want to say, because after that, you know, because otherwise it gets into a rebuttal of back and forth.
Well, and even the last
not
one
a
that we
court of
put
law,
on Zoom,
you know?
they were,
This
you
is
know,
not redirect.
right. But, and again, I had to explain as calmly as possible that this was not a dialogue.
Right.
And so clearly.
Yeah, it's not like an information getting session for the public here.
Yeah.
I mean, it would be nice, you know, on the town website if there was a, you know, general rules for public participation kind of guideline, because people, you know, I mean, people who are very passionate about something get very nervous and very intimidated. And we certainly want to encourage reasonable public participation. And, you know, it would be nice if people had a little bit of guidance I could I don't know, Elaine, we could certainly reach out to town council just to see if they had any ideas about kind of a singular format. But I think we do pretty well. It doesn't happen very often. Other meetings have much more public.
Yeah, we don't.
But I think measuring expectations is always.
Well, I think, you set by example too, if they realize and know that, we're concerned about, the rules and trying to explain to people what the behavior should be, what the process is. And if they learn that, the Board of Health is doing it this way and they're following the right rules, then maybe we should adapt it town-wide and put it on, like you say, like on the town website. Because most people don't know. I had somebody call me about, how do I put a complaint in? How do I do this? How do I do that? And people don't know. And I think you have to be more explicit. And in this age, everything is techie. So everything is on websites. And if it's not on the website, then people don't bother, I think, sometimes with it.
Am I muted?
Nope.
No, you're there. We see you.
We only see your eyes though, like,
I see you. We hear you.
So each board can make their own rules for their public hearings. So I would not be in favor of the town publishing rules of public hearings.
Yeah.
If you're having a zoning board meeting, that's different than the Board of Health doing regulations or conservation. So if we want to put on our website our protocol for having public hearings, then that's fine.
Yeah, that's a good idea, Ruth.
Okay, yeah.
So I can distill what was on that training, and then assuming we usually would have the same rules for no matter what the hearing is, then then Cindy can put it on the website.
Okay.
That would be good. That sounds good. Thank you, Ruth. Okay, next on our agenda is the Health Director's report.
So yeah, I didn't write anything because it's just too much going on. So today's number is 338. Let's see. No, yeah, 338. It's been the same since Sunday. So Sunday, Monday, Tuesday, Wednesday has been the same for 338. So I'm assuming you've all been following the governor's thing of red, yellow, and green. You saw that we're green. To not have 5 cases over 14 days would be very remarkable. We haven't, I sent you the spreadsheet of per day since July 1st, so you can see we've never had 14 days. Well, let's see. I don't know. I didn't look at it that way. There might have been 14 days at one point. There was a stretch where we had very few cases, but I'm not sure if that was over 14 days or not. But, four cases over 14 days is not. So anyway, we will probably, so let's see, for our coalition, Medford, Melrose, Stoneham, Wakefield is green, and Malden is yellow. So that kind of tells us where we're at. The thing that can wallop that designation quickly is if you have a nursing home outbreak. Hopefully we're past that because they're doing so much testing now that hopefully they're catching it quicker. Or, any kind of outbreak. So that's good. What did you, any feedback on the spreadsheet about numbers of cases?
No, it was just helpful because you know, I didn't today, but I tend to check, but you know, you don't know over time what would look like. So I really appreciate that you did that, Ruth, just to kind
Yeah,
of
I need to update it again. I think, yeah, I find it actually very helpful, especially when I, you know, count it by week. So you can kind of get a feel from week to week to week. Clearly, Melrose was way out of control the month of July versus Wakefield. So that was kind of interesting. We don't normally release ages, so I would appreciate if you don't release or repeat any of the ages information that was still lumped together, but that's been a question, especially with school reopening. So I thought that was helpful if we put that in. The other thing we sent you that you asked for was the complaints.
Yep.
So those continue.
it didn't seem as excessive as I imagined.
Yeah.
But the themes certainly are the same.
It's not terrible. It just is time consuming.
I know.
Yeah. I think it was interesting though with that. I kind of, some of those places, you know, you've been to or we frequent, and we may not have seen anything happen, but now that I know that they have had you know, a little bit of an incident here and there, and they've had to be corrected, I think that if I am in those in that area, frequenting those facilities or something, I think I'd be more aware of looking at.
Just because there was a complaint doesn't mean that we found that there was a problem.
Right.
Yeah, it was
So
just interesting to know.
Keep that in mind.
Yeah. But it was interesting because some of them I noticed I'm in a lot, I'm like there a lot more because I was locked up the first 10 weeks, but since then I've been out and I've never seen, you know, anything. So it's just interesting to see. Like one particular place had 3 or 4 like within a 2-week period, and I'm like, geez, I wonder. I never saw it. It was just interesting to see.
Madam Chair, we lost.
Did we lose? We lost her.
Candace is off the
Lost
call.
Candace.
Sudden. Hopefully she'll come back on.
She was frozen for a minute and then she turned.
No.
She should be coming back.
I'm sure she'll come back on.
Yeah, just so you know.
So those are only the COVID complaints. Interestingly, during the peak of the pandemic, when we said we weren't going to be doing housing complaints, we didn't get any housing complaints. And now we do. I don't have an explanation for that. I just know that that's the way it is. So I do know that Coral's been really busy and hasn't really been able to get Candace's back.
Yep, she's back.
She really hasn't been able to get to doing the food inspections because she's spending all her time responding to complaints. We did hire a new inspector to replace Jen, who will be starting on the 24th. And I have hired one of the Medford health inspectors to work nights and weekends temporarily for Melrose and Wakefield to just start to get into some of these places, like the 3s and the 4s, especially the 3s and the 4s. Not concerned about the 1s, but so, I mean, clearly this whole year is completely messed up as far as food goes, but I think we need to start getting back to it. We are holding a Serve Safe class next week. We can only have 24 people because you can only have 25 in the room. You know, so we have 24 students plus the instructor. It filled within a week, or filled in 1 week. So we're using a different company this time, and Coral's going to sit in because I have to take my mother to a doctor's appointment. So if Coral says, yeah, this guy is good, we'll use him again in September. The person we've been using really doesn't want to do it anymore. So and using this company, you know, is way easier for us because they do all the registration, all the money, everything.
Yeah.
So while we have the grant, we're still subsidizing it. But let's see if I can look up what the cost is. Is it like $700? No. Yeah, I think it was about $700 that we're paying the balance for the students. Plus, we need to pay for the space. We're doing it at Memorial Hall because it's big enough to have that many people. So I think it's going to cost us about $1,000, which the grant will pay for, which is basically what we paid Arnie. So, so if it's the same cost and no aggravation, I
So
say
what are the participants paying? Are they paying anything?
they're paying $75, which
Okay.
is what they were paying before, which essentially is the book, because that's what the book costs.
Right.
And so they would normally charge $99 per person plus shipping and handling for the book. So we're paying the $24 per
Right.
person plus the shipping and handling.
Gotcha.
Oh, nice.
So that's good. And we're setting up a date to reschedule the Spanish one that the Medford Health Inspector is going to do. Again, we'll do it. We'll do 24 and we'll do it at Memorial Hall. We won't have to pay her unless it's on a Saturday. And that will help. So, and again, as I said, if this guy is good, we'll schedule another English speaking one for September too. So that's good. We're actually starting to think about food protection again. What else? So I've been talking with this, well, you know, tonight the school committee is voting on their back to school plan. I've been involved, not every single meeting, but you know, like they invite me to a meeting once a week or every other week or whatever, and I put my 2 cents in, and
So we'll see.
so, you know, we'll see what happens. You know, it seems that the Class C students, which is basically special ed kids, in preschool will be in person, and hopefully kindergarten or kindergarten and first grade, depending on what they can negotiate. So that being said, you know, if there's any kids in the school, then there has to be a nurse in the school. So that takes care of the school nurses. They'll be there and they'll be working full time. They will also be helping with contact tracing if we need help again. As I said in an earlier meeting, a couple of them, maybe 2 of them, helped over the summer when we had a blip, and they helped us with that too. So we'll see what the vote is tonight and what they're going to do. And of course, they're still in negotiations with the teachers union. So, you know, stay tuned.
Mm-hmm. Thank you, Ruth.
I'm trying to think if there's something else new that's been going on with COVID-19. The travel advisory forms that people are supposed to fill in online will have access to, but we're not charged with any follow-up. I mean, unless there's a positive, in which case we normally do. So.
Yeah, I have family who just did that. They're here now.
Well, people are still stupid. So my counterpart just eliminated the Medford High School graduation that was supposed to be this weekend because they had kids who went to Mexico and came back positive. And they just said, no, we're not going down this road. So
Yeah, I'm so glad that Wakefield did what they needed to
Yeah.
do in June.
yeah, me too. I mean, Melrose's went fine, but I'll read you what she said. I just canceled the Medford graduation that was supposed to happen Saturday with 500 plus people. Had a group of seniors went to Mexico, 3 tested positive.
Mm.
1 was out and about while awaiting test results for 5 days. Others have not been quarantining.
Right.
Also have 2 unrelated seniors positive this week.
Yeah.
So, I don't know. You know what, I don't even know what to say anymore. I can't even tell you how many people have been calling saying, I'm going on vacation to wherever. Can you tell me again what I need to do when I come back? And I'm like,
Mm,
I'm going on vacation too. I'm going to New Hampshire.
right.
So do you have to go out of that far out of state? Why can't you stay in New England?
Yeah.
Why are you letting your kids go to Mexico of all places?
That's true.
Yeah.
Or Florida? I mean, come on.
Yeah.
Doesn't make sense. I just had somebody who is local coming back from spending time with family in one of the states. Unfortunately, they had to go. There was an emergency. So
Oh,
coming
that's
back
different.
to try to get a test to come back home was horrible. And
Right.
called me from out of state and said to me, what do I do now? And I said, well, try this, do this, and finally got an appointment.
But they can get tested here when they get back, right?
Yeah, but they had trouble there. They had called their primary care, and the primary care referred them and to the place that they went to, and they said to the person, oh, we don't have time for you people that are vacationing. And she said,
Right.
but do you
Yeah.
understand? I'm coming home. I unfortunately was called out of state
Yeah.
for a family emergency. It's 6 weeks. I want to do the right thing.
So they have
you
to
know,
quarantine.
yeah, yeah.
Quarantine.
So she's going to have her test, has been quarantined, and then it's going to go have a test, and just to make double sure.
Well, there are 18 communities with pop-up clinics that.
There are. I think what it is that a lot of people don't, I don't know if you do, but I'm finding that people are not paying attention to the changes. Like you talk about New Hampshire. We go to New Hampshire and I get the things every day to keep track of what's going on up there, the number of the cases. I mean, I don't want to even go anywhere, to be honest with you. And it comes time for a vacation. Who wants to travel anywhere where it is? You're taking such a risk.
Well, you know, Rhode Island's off the list. Maine,
Yeah.
you have to have a test to go to. Vermont, you need a test unless you're quarantining. So the universe is shrinking.
Yeah, not many places to go. There goes my retirement trip to Florida is still out there.
Getting back to the schools, because for sure on that decision about graduation, they kind of really were very grateful that the Board of Health weighed in. And I think that they need, you know, occasionally they need to hear from us. It's kind of a little bit bad cop, but, you know, certainly let us know if they feel like they need I mean, because you've been there on the ground with them, which is great. Every so often, Superintendent Lyons transposes Board of Health with Health Director. He almost always corrects himself, but I just always worry that I'm going to get pinned with, well, what did you say? And I'm like, you know, that's a Health Director situation, but, you know, certainly if it
There
comes.
are some outstanding issues.
Yeah.
And it's not specific to Wakefield, but, you know, applies to Wakefield with some of these DESE policies that you may end up getting involved with and overturning, which you can do.
Yeah.
And I may advise you to do.
Yep.
For example, they still have this 3-day quarantine for students. And most public health officials are saying, no, quarantine is 14 days.
Yeah.
It's not different if you're a student. So if they don't revise that, a lot of boards of health are going to just pass a local regulation
Okay.
saying quarantine is quarantine, and it's 14 days, no matter who you are. That's one outstanding issue. They've also put out policy or directives, or whatever you want to call them. One of the big issues is just practically speaking, and you guys are all nurses, so you know what I'm going to say. You know, they have a list of symptoms that, you know, at least the part that says headache, it's headache and one other symptom, or runny nose if they don't already have known allergies. But the list is long, and everybody here has had children and knows that in the elementary school, 75% of the kids have something at some point, right? I mean, that's just how little kids are. So to say that if a kid has, you know, a sore throat or a cough or the sniffles and a headache or whatever, they have to go home and be tested.
Yeah.
A, where are they going to find these tests? B, how long is it going to take to get these tests back? Although the state says that 75% of the tests are back within 72 hours.
Well, the spot testing is coming, you know, but, and again, is it an antigen test or a PCR? I was reviewing that, and the specificity of the antigen test is 40%.
Yeah.
I know.
Yeah.
So they're not differentiating that. They're just saying a test. But, you know, practically speaking, there's not going to be any kids in school in the elementary school if you send every kid home that has anything.
Right.
So it just doesn't seem, I understand where they're coming from, but I don't know. It doesn't seem realistic. So that is another thing that's on the table, outstanding on the table. The other thing that's outstanding on the table is they're saying that every community come up with their own, I just blanked out on my word, but number of how, when you want to, you know, you hit this, you're closed.
Threshold?
Cool. Yeah.
So, you know, that's ridiculous. I've seen a few formulas that some have used. It doesn't take into account the teachers, because, you know, the teachers don't all live in Wakefield. So we're not going to know who the positive teachers are. Well, we probably will, but we don't get those reports, you know? So there could be teachers that are positive that stay home, but they could just call in and say, I'm sick. They don't have, you know, they may not say they're COVID. They just may say they're sick. So is this formula supposed to be only kids? Kids plus teachers? Kids plus teachers plus staff? Number of cases, percentage per population? You know, what paradigm do they want to use? And having every community do something different is nuts. And then, of course, we also have the VOC. So 12 communities that range from Reading, which is white, to Chelsea, that is red.
Red.
And everything in between. So how are they supposed to come up with this? And it's not just the VOCs, it's also regional schools. So that is on the table right now and has been brought up to DESE as, you need to fix this. There are school districts, as well as regional schools, as well as VOCs, that this just doesn't work for.
So, you know, I think about the end point, which is a vaccine drive as soon as possible, hopefully January. But I mean, that's going to be the only thing that fixes this, right? Oops, you're muted.
Yeah, you muted yourself? Did she mute herself? We didn't mute her.
No.
Can you hear me now?
Yep.
Yeah.
Okay, sorry. I was trying to actually turn up my volume and did just the opposite.
Mm.
Shocking. So even when vaccine is available, it's going to be rolled out.
Right.
And, you know, let's face it, healthcare workers, public safety, because they think they're important, and elderly
To them. Yeah.
are going to be
Talk.
the top. And, you know, those discussions are happening now, and those protocols are happening now. But again, you know, is it going to be based on who's most likely to have severe consequences? Is it who's more likely to spread it to other people? You know, what is the criteria they're going to use? So I doubt that school children are going to be, you know, anywhere near the top layer.
No, it'll be almost, it reminds me also almost of, I don't know if you remember with H1N1.
Of course I remember.
The superintendents would, we would have to take account of how many students were absent, and the nurses would call it to the supervisor. And then we would turn it over to DPH and DESE. And DESE would allow, at that time, most of the superintendents to decide whether or not they wanted to close their schools. And then at that time, with H1N1, it was the kids, the younger kids who didn't have it, so they were the top priority. So you had everybody else mad at us. So it's almost like we've reversed it. And, you know, it's a hard thing to decide. When do you close the school?
Well, it depends on what you use as your protocol. And
Yeah.
those will not be our decisions. Those will be carried out. So I don't anticipate, and then of course, you have a lot of people saying they're not going to take the vaccine even when it's out. Not as many, it's been in other parts of the country, as you can imagine. So, you know, I don't foresee this resolving anytime soon. Hopefully by the end of this school, you know, this upcoming school year. But so actually that's a really good segue, thank you, for flu clinics. So Karen and I have been talking, we've ordered additional flu vaccine, but you know, it's a guesstimate. We don't really know how much demand there's going to be. We have discussed doing a drive-through flu clinic that Elaine, of course, will help us with. And also, I think we talked about this at the last meeting, doing family clinics. I mean, ideally, I would like to do family clinics at each of the schools if we have enough demand, and maybe do it by appointment so that, you know, not everybody's coming in at the same time, and, you know, see if there's a need. If there's no demand, then, you know, whatever. We have been requested by the farmers market to come to 2 farmers markets rather than 1. So Cindy, could you get back to them and ask them, are there particular dates that they're looking at? We don't have the vaccine,
Sure.
so it's a little bit of a moot point, but.
Usually we do the end of September. The first, the one that we do is like around September 29th. And then, so that kind of would work with the flu, right? If we have it by then, flu season, and then maybe in October. Because the last market is like the 17th.
Right, but if we have it earlier, we could do it earlier.
Yep.
So, all right. We're buying from 2 different vendors to kind of cover our, you know, hedge our bets. We haven't heard from either of them that vaccine is being delayed.
No,
And
they're not saying it.
we're trying to get more vaccine from the state, but we missed the deadline for asking for more vaccine. But we're still pushing to try to get more, because traditionally we just don't do kids. So we only been getting vaccine for kids for the SEAM Collaborative. So I think what we have to do is use that up and then say, you know, we have a pediatric clinic scheduled, we need more vaccines. So we're just gonna have to float that boat. CDC has come out with PPE recommendations, so it is gonna be different. This morning conference call, we found out that we can use our FEP money, our emergency preparedness money for that, because it's for an emergency dispensing site. We can't use it for syringes, but we can do it for gowns and face masks and gloves. In the past, Candace, the nurses, most of the nurses have chosen not to use gloves and to just sanitize in between. But this year they're gonna have to be wearing gloves, which was gonna slow things down, but it is the way it is.
And that's a glove that we would change between every patient, or would we sanitize?
Every patient.
Yeah.
Okay.
So you can imagine wiping your hand down with sanitizer. So now your hand is wet and now trying to get a new glove on.
Okay.
Not great.
Is there a recommendation, Ruth, to
Yep.
wear face shields also?
Yeah, you know what? I read it brief. Somebody asked me that this morning and I didn't have time to go back and reread it. I can't remember.
Yeah.
So I remember the masks. I remember them saying gowns are not necessary. And I remember the gloves after every person, but I don't remember. So I have to go back and reread the face shields part.
Okay.
And then the 5 community emergency preparedness communities, we're putting one order in all together. So we'll get a better price and it doesn't cost us anything because we're using our emergency preparedness money. So that's good. So we still have almost $10,000 that we have not spent of that 50,000 we got up front. So, and you know, it's supposed to be health department related. Anything you guys can think of that?
So we spent 80%. We have 20% left. That's what you're saying?
Right, we've spent 40 of the 50. That was mostly, I mean, the number 1 expense was the hotel. Number
Right.
2 expense was salaries. Number
Can
3.
Can we offer bonuses to any of the, like any of the school nurses or anybody that's like spent a little bit extra time doing contract tracing?
You mean all us people doing contract tracing?
I wish.
Is there anything?
I would like a bonus.
Yeah,
Sounds like a bonus.
yeah. There should be bonuses for a lot of you people. Let me tell you, I agree. What about something material-wise? I'm thinking you want to do something like a drive-through clinic. Do you have enough of signage, of vests, of printers, of, you know, folding tables that not only would be used for that, but be used in any kind of a
Right.
thing, something like that? Can you think of something like that you would need?
Yeah, I want to find out. I've been using DPW's pop-up tents, but I think they only have a couple.
Mm-hmm.
So I was going to ask them how many do they have and probably augment that.
Mm-hmm.
It would be nice to have a pop-up tent with the health logo on it.
Yep, we can do that too.
And certainly, you know, and my other thought too is whether or not there'll be a place for us to, you know, have at least a couple of Lucite or whatever people are using barriers just in case we get pulled into not a flu clinic, but a COVID clinic, or, you know, I mean, I just sort of feel like we should have maybe that, you know, some kind of see-through barrier.
So WB Mason has a plexiglass barrier that sits on
Right. The
whatever
table.
you want to sit on.
Mm-hmm.
I don't know how steady they are, but they're certainly worth looking into. And
Have the one thing I think that we haven't used, but I've always sort of wanted us to have more, are the privacy screens. How many of those do we have? Like 2?
None. Great
Oh, good,
idea.
yeah.
We need privacy screens.
Great
Especially,
idea.
Yay, baby.
especially if you're doing
Fabulous.
PD, to do PD, you know, to put them behind.
Great idea. I love that idea. And we could, you know, we've had to do, since we've only had to do an IG clinic once when it was JJ Grimsby's issue. But, you know, with an IG clinic, you have to have it because they're getting it in their butt. That, and we would also be able to use them for sheltering.
Yeah.
Yeah.
So I think that's a fabulous idea. Let's spend it. I'll spend it on pop-up tents that say health department and a couple of the plexiglass that we could move around and shields and, I mean, privacy screens and some more A-frames that have the Melrose DPW went out and bought 30 A-frames, but they bought the kind that doesn't have the plexiglass in front.
Oh.
So you could make a sign and then stick it to the front. And if the weather's bad, you're screwed.
Right.
Yep.
So I think I'd also like to buy, like, you know, if I can, like 5 or 10 more of those, because especially if you're doing a drive-through, having a lot of signage is very helpful. And I actually just counted our vests, and we had about, don't quote me, but we had about 15 yellow, which are usually our volunteers, 15 white. No, hold on. No,
Red.
15 red, which is usually our nurses, 15 white, which is our volunteers, a yellow and a black. So, and of course there's also Melroses, you know, as long as we're not doing it at the same time.
Do you have any of the ones that are the reflective type?
They do have reflective tape on it.
But they don't like the solid green or the solid bright yellow that are reflective. We use those for our drive-through clinics a lot. They were very good. They really, you know, I don't know if that would be.
Cindy, I don't have paper with me. Cindy, can you write a note? We can order some of those too.
The vest with reflective?
Yeah.
Yeah, like the bright colors.
Spent the $10,000 now.
Yeah.
No, and also we just purchased something, you know, this communication with masks on to anyone who's hearing impaired is getting pretty tough. We just purchased a pocket talker, which is a microphone on me and earphones on the person I'm talking to. The problem is that the earphones are not, I mean, you would have to figure out some way to sanitize them. But if we ever had someone who really was having a tough time because we had a mask on and they had a mask on.
What about if we got some clear masks?
The clear mask, yeah.
That's possible too, but it's just it's the hearing and the muffling. I mean, it was a $150 product, but it made a huge difference. And
I know, but how do you sanitize them?
I know.
People?
I agree.
But if we got a bunch of the clear ones, if somebody was hard of hearing, we would just switch masks to the clear one and they could be our.
I know, it's so tempting to put on. I mean, my sister's a speech therapist, so she has 15 iterations of how you do this, but sometimes it's good to put on the shield and then almost kind of do a beekeeper action. So it's kind of like,
shield is not substitute for a mask.
Yeah.
It does if you then close the rest of it, but that's just the hood.
Do you think your sister would know of any sources to get clear masks?
Yeah, I'll check with her.
Could you check with her? Because that would be very helpful.
The one she has is a little clunky, but I mean, she's been following blogs with speech therapists and it's been very.
Well, I think that would be a great resource though, to get those particular kinds of masks.
Okay, I'll look at it.
That'd be awesome. Thank you.
Okay.
So that's where we're at with flu. and COVID. Things, as I said, are ramping up, mostly issues with schools, the new travel advisory, the new outdoor limits. The Little League did send a letter out to all their parents saying, you know, can you just have one person come per household to try to, you know, to decrease the number. And then last night's game, there were a zillion people there again. So, you know, I said to Steve that to me, that's police enforcement going by and saying, look, guys, some of you have to go home.
Yeah.
The governor has charged police departments with doing more of this enforcement.
Yeah.
So on my list of things to do is to call Scory, who's going to say they're not the mask police, and I'm going to say, yeah, but you do need to help us here with basically crowd control, which is really what it is.
Well, we also need a little bit of example keeping. So there's been, you know, this neat little new tradition where people have been doing car parades, but they tend to congregate wherever they're meeting, and they're, you know, someone's right outside the car talking to the other person, and I'm like,
Yeah.
well, guys, you're examples. Like, what the heck? You know, and we know them all, and it, you know, it's an awkward spot, but I think it should be, you know, we just got to double down on being good examples, because I've seen a lot of just kind of average chatter stuff.
I think a lot of people too, I don't know if you've noticed, but I did, is that people get very confused when they're outside.
Yeah,
as
they're close
to,
together.
Yeah, can I be outside and sit 3 feet? Can I be outside and just wear the mask? I'm not going to go to the cookout and sit and wear a mask, or you're not going to go to a wedding ceremony that's outside and there's only 50 of you, but do you wear your mask outside? And you know, people get, I think, are very confused as to whether or not they should or shouldn't wear it outside.
We could have the kids, the leadership, do a PSA again.
Yeah, do something like that. And it is confusing because I have to think about it myself sometimes, you know, and you get out of the car, I'll automatically put it on and people look at you and they go, why don't you just wait till you get to the door? And I'm like, no, what if I pass somebody?
Yeah.
And not to wear your mask while you're driving. I mean, I've had some people, they're swaying back and forth, you know, but I think a lot of people get very confused as to whether or not you really should have a mask on outside.
Well, and that there's a difference between carbon monoxide and carbon
Yeah.
dioxide.
Yeah. Yeah. People don't.
So
It's unreal. It's something that we never thought that in a time that, you know, we never thought that we would do, and something where, and I don't think people understand that we ourselves, this is new to us too. So we have to learn, we're part of the learning curve. So you have to go along and, you know, just listen to us, to what we say. We're doing the best we can.
Well, and I imagine too, you know, we need to be ready for when the weather flips and these, you know, restaurants have been just making it with outdoor dining.
Yeah.
You know, I feel for them and what that business model is going to look like when the weather changes. We'll see. One more thing.
I hope they put heaters outside like they do in downtown old San Diego, and you can sit there with your winter coat on and a heater.
I've gone to restaurants in Boston before the pandemic that did that.
Yeah.
Nice. It's a nice thing to do.
Yeah.
We'll see. Do you have anything else, Ruth, for the director's report?
I don't think so. They came out with a nice chart, 2 nice charts today. One that kind of explains the differences between the different tests, and I gave it to Jen McDonald, and she's going to put it on the on our website. The difference between, you know, antibody, antigen, and
PCR
testing. And then they also came out with another good chart. What was the other one? About face coverings that kind of addresses what you were just talking about. So I will ask Jen to put that one also up on our website, because It is very confusing. There's just
It is.
been
Candace has been
so
good.
many
pushing
orders
stuff out.
over so long a time that one supersedes the other and blah, blah,
Does.
blah. It's very confusing. So I think these two charts do help clear things up a little bit.
Oh, thank you, Ruth. Appreciate that. Okay, is there any other business that come up or anybody is in, knows about
Make it
before the
not so
post?
hot. I'm too hot.
Heat wave on.
So I'm on vacation Wednesday through Sunday next week. Unfortunately, so is Karen.
Ooh.
Yeah.
So Cindy's in
So
charge.
Robin Adams will be in charge for cases, and Coral will be in charge of anything else.
Who's in charge for cases?
Robin App.
Adams,
Oh, right.
one of the
Yep. Tracy.
Melrose school nurses.
Yep.
Very nice. And Coral is, Ruth, I forgot to mention that too. I got to meet Coral on a professional level.
Oh.
She is phenomenal.
Fantastic, isn't she?
Just a breath of fresh air. She
Yep.
was so professional, so well prepared, knew what she had to do, knew every single solitary thing. And I'm one that worked with inspectors, so I suppose I could be a good evaluator, but she was great. She really was extremely thorough.
Okay.
Well, since being promoted, she's really embraced that. So, personally, her daughter's going off to boarding school at the end of the month, so she'll be, an empty nester by herself because she's a single. So she's,
Very nice. Very
she's
nice.
one of those mother-daughter duos that basically does everything together because it's the two of them.
Mm.
So
A new chapter.
it is.
Yeah. Be interested. She's very nice though. Extremely professional and very well prepared and extremely thorough and very helpful, very down to earth, explained and talked to me about something, about a complaint. I mean, she was great. She was and she got it. She got a good result. She really did. I don't think she knows, but she did. It came out well. Her recommendations worked well. I did what she said and they come out great. So far, my fingers crossed. I was glad.
So I just have a tech suggestion, which is occasionally just be sure that Zoom hasn't stuck another update, because if you have not updated on Zoom, you will get kicked off time and time again from the meeting.
What do you mean updated?
So Zoom itself has updated versions, and I think it's to increase the security.
Yes.
So if you find that you're really frustrated with Zoom, in the very beginning when you get onto Zoom, you may see an icon that says suggest update. And it's really important to I don't know, Candace, if that may have happened to you tonight, but that was
no, it's a poor internet connection, unfortunately.
Well, that being said, do we want to consider a person meeting?
What would you like to do for your next meeting?
I want to meet in person. I just want to see, I want humans.
We miss each other.
Yeah, it just like when someone walks into the room and you see them and I don't know if it's like, it's just, you just get that connection, or you just see how they really are, that they are okay. I think we've just been away. And like I say, I think Zoom meetings are wonderful, but I think like Laura was saying, even if we had to have some kind of a hearing, no way. I think we would have to be in person and everybody else would have to be in Zoom because of, the spacing and everything like that, and making sure you had it big enough. But I think that we would be safe to meet. And I think that, I think it would be a good idea.
I mean, currently the school committee is meeting. 3 of them are in the WCAT studio and everybody else is on Zoom. Mm-hmm. So it's
How do they decide who's in person?
Well, it's the chair. I believe it's the chair, the co, and the superintendent are in the room. I don't know. I mean, I've just noticed that when I watch it. I don't know.
What channel is it on? I'll turn it on after this.
22?
22 or 13.
Okay.
It's also on WCAT Facebook.
Oh, okay. I can do that. I told Doug that he asked if I could be on the meeting tonight. And I said, well, I'm on this meeting, but I
Yeah.
could
I want to watch it.
come in after the other meeting. I'll go in through WCAT. That's a good idea. Candace, what about you for in person? I know you're the only one with kids at home.
Like, am I comfortable with it? I'm totally comfortable with it. I guess my question is, are you guys comfortable with me? I mean, I'm working full time and both of my kids go to daycare. I'm kind of like a walking germ factory. So I'm completely comfortable. I mean, I've been going to work. So
Yeah.
We'll stay like 10 feet away from you.
yeah, that's good. I should have like an extra
Candace in the
bubble
corner.
around me.
Yeah.
I feel very comfortable.
We'll
you
get
know.
one of those. We'll put one of those movable plexiglass things in front of you, Candace.
Yeah.
Well,
Oh,
we could
cool.
do that.
I got an extra face shield I can let you borrow. Maybe we could decorate it for you. You know, like my name is Candace. I don't know.
We
I
could
can wear
do a
like
face
some
shield
safety
like a-
goggles on top of my
Yeah.
face.
Oh, please. I've worn enough. And if we have between having my husband have surgery, everybody coming in and out, wearing masks, not wearing masks, this one out, taking the shoes, spraying Lysol. See you later. I've had
We
it.
can give you a face shield and let your kids decorate it.
Yeah.
That
there
would
you
be awesome.
go. All right, we'll set, before we do our adjournment, I think the next meeting is, we're still back to the third Wednesday, am I correct?
Yeah, but
Yeah.
I'm going to suggest, it feels like a month was too long
Yeah,
to me.
I agree.
I mean, I just missed you all so much.
Mhm.
Maybe every other week for next, you know?
2nd and 16th? September 2nd?
Yeah, I'm here. That's fine with me.
Yeah.
It just seems like there's kind of issues going on right now. And if there's no issues, that's fine. We can have an easy meeting and say, nice seeing you all. Goodbye. All right. So we'll schedule that for in person with Zoom, remote for the public.
Okay, so we'll do the one on September 2nd in person.
Yep, I'm gonna put it on my calendar right now.
Elsewhere. I guess I'll have to drive home.
Yeah, I won't be able to leave, but that's okay. That's the start of the week, so it doesn't matter.
Elena, you having your hit?
Oh, wait a minute. Wait a minute.
No, that's not gonna work.
My turn, you mean, to have my
It's your turn.
bionic piece put in? Not yet.
No. Can we, I have a mammogram that I've already moved once from June to September, and I really don't want to move it again. Can
All
we
right.
meet at 7:30 instead of 7:10?
Yeah, on the 2nd?
Yeah,
Yeah,
yeah, that's okay with me.
Yep. That's fine.
okay. And if I'm not on, just start without me. It just means I'm driving. It's only in Woburn, and it's usually, in, out kind of thing.
Yep.
Of course, this will be the time that it's not, but you know how that is.
So
So
are we doing in person or not?
Yeah.
Okay.
Okay.
And where are we doing it in person?
The first floor conference room.
Okay.
It has a name. I don't know what it is.
All right. But it should be pretty easy to find.
Yeah, town hall,
Yeah. All right.
the first door on the right.
Okay.
And then we can finalize flu clinic dates and all of that. And farmer's market.
Yeah, well, with any luck, we will actually,
Have flu.
we'll have the vaccine.
Good.
You know?
I'll be the first in line. I need it right away for school.
Yeah.
I need it by August 15th. I haven't seen anyone with it yet, but
No, not even CVS. I haven't seen CVS,
we're
Walgreens, or
waiting.
anybody with it. No.
I think Walgreens has it.
Oh, do they? I heard from a couple of health departments today that they're going to have it by the last week of August, they were told by the reps. We have a meeting, a public health
Tell
meeting with,
anybody that.
yeah.
I get
They
my
say
flu
that,
shot
but
for
do you
the
ever,
whole
I
week.
never believe them. Yeah. I never believe them until I see it in my hand, till I see the box come in the door, I used to say. I never believed it till the box arrived. All
Yeah,
right, so we'll do that for the second in person at 7:30. And do you want to schedule the 16th at 7. Will that also be in person?
Yep.
As long as it's working fine.
I think it's a good idea.
Okay. All right.
Yeah.
So we'll do that. So can we have a motion to adjourn?
I'll make a motion to adjourn the meeting.
Second,
Okay, second. All in favor?
Orville,
Laurel?
I.
Linehan, aye.
Panther eye, silver eye, 3 ayes have it, no nays. Everybody have a couple of nice weeks and enjoy.
All
Stay
right.
cool.
Keep
All
it
right.
I'm gonna.
Bye-bye. Thank you.